our students are going to become citizens of a global community.
Much of global poverty is tied to global health.
It's incumbent upon us to teach these students about those issues and how to think about solving those problems.
The world has become very, very small, and I think we are beginning to pay attention because diseases have no boundaries.
We live in a very interconnected world, and to think about global poverty as being a problem that is far away, and I don't personally have to be engaged in the solution, that is an old-time way of thinking.
With the support of Rice, I'm going to the place where there's the greatest need.
To bring together these really smart, energetic, passionate people and focus them on this particular problem, not only can we transform the way that education is done, we can transform the way that research is done.
Students in these courses have learned about issues of world health, and now what they do is undertake the engineering design process to solve some of those problems.
In many countries, people do not have access to a healthcare provider. And so physicians from a central facility will travel out into rural areas to provide healthcare, but they don't have a lab that they can take with them. So our students have developed a backpack that contains all of the elements that you would need to diagnose the diseases that are most commonly found in that country. And so students have made backpacks that have been tried in Honduras, in Guatemala, in Haiti, in Lesotho, in Tanzania, and in Botswana. And they've customized the backpacks for those particular settings to help those physicians provide more effective healthcare to patients.
The Beyond Traditional Borders program has the opportunity for students to go to the developing world, see what it's really like in that environment. They will come back and be much better able to create real solutions that are going to work.
This is our WFP table, and this is where we work every day. WFP is the World Food Program, and Tessa and I have been in charge of the distribution of the food, which is called corn soy blends. The doctors here wanted the WFP to come in and be able to distribute food here for a long time. Our coming here is a way of allowing this program to happen.
From an educational point of view, we offer amazing opportunities for students to grow not only intellectually but also humanely and personally, and again prepare themselves better for an increasingly global workplace.
We're giving these students problems that come from Lilongwe, Malawi, from Blantyre, Malawi. We want to use that as a way to inspire the students to actually create a functional solution that they are then expected to take into Africa and make it work there.
Kids just get so enthusiastic and focused and hungry for meaning. They're hungry for what they're doing, you know, the minutia of chemistry or bioengineering that they do, to see that matter.
You really had a sense of ownership because you knew that at the end of the semester, this was going to be something that would actually go and help people, and that you had a chance to go help and implement it. Our project was a program to generate pediatric dosing guides for the HIV patients. So we worked with the doctors, and their #1 concern was make it simple, make it take less time. So Rachel and I just said, all right, 20-second rule. Can't do it in 20 seconds, toss it out. If I hadn't had the planning experience that I had in Houston, I would have been in the dark once I got to Botswana. I knew the design process. I knew what needed to be done to make an effective intervention.
I think that education can be equally as life-saving as technology, maybe more life-saving. So I think it's critical to improve education across the board. And I think the best way to do that is to engage students in doing science that matters.
Okay, we're gonna go inside. I'm Sophie.
I'm Christina.
And we're students from the U.S., from Rice. We're here for the summer at SOS, and we're teaching about HIV/AIDS and health and
And we implemented our HIV education activities that we had been designing all last spring. We're teaching them how HIV attacks the body. We incorporated a lot of games and interactive activities to get the messages across.
A lot of our task during the class was to think of what are your financial limitations, your cultural limitations, your language limitations in this other setting. How is the environment you're in going to affect the success of your activities? All these questions are very good, so I'm very impressed. We got here and found a lot of things that we didn't expect, so that in itself was a great learning experience.
I think what the RISE initiative of actually bringing American young students to Africa is the greatest thing that we've ever done. It changes your whole life. It's a whole different world. When you come to Africa, it's like they'll never be the same. It's a great opportunity for them to actually interact with people living with HIV, you know. Most of them, I don't think they've ever had the opportunity to meet people that are infected. And to actually realize that, hey, if I'm infected, it's just as normal as the next person.
We can't solve the problems of global health unless we bring not only technology to bear, but an understanding of culture and of communication. Our students need to be able to integrate all of that if they're going to contribute to the solution of both today's and tomorrow's problems.
1/3 of the people in the world live on less than $2 a day. When you're living on $2 a day, everything that you have goes into your survival. We don't just need new technologies. We need new ways of implementing those technologies.
All the rest is really important. The development, the science, the engineering are critical. But the science and engineering don't work unless you can get it on the ground and get people to use it. And that's one of the things I think we in business schools can bring to this.
What we're trying to do is to leverage the experience within the Jones School of Management in the area of technology commercialization and in the area of micro-entrepreneurship.
Microfinance is currently being used by about 30 million entrepreneurs throughout the world. There's an infrastructure already in place where we could deliver medicines, healthcare.
You can always publish another paper about a technology you've invented in your laboratory. But what is the impact of that technology if it never reaches a patient or a community that could benefit?
RISE is able to collaborate outwardly, in particular with the fantastic institutions of the Texas Medical Center. RISE has a demonstrated ability to work with all of those different kinds of institutions in solving problems and in undertaking research and in finding the ways in which the fruits of that research can be applied to help people.
There's a culture that supports taking risk, that supports thinking out of the box, and if you can make a case that it's important and it's going to matter, people will do it.
A measure of our success will be the extent to which the technologies that are developed by our students, by our faculty, have impact at home and in developing countries. And to do that, we have to bring together scientists, engineers, physicians, educators in Houston and in developing countries. We have to be partners.
Really has set the course of my life, my aspirations, and made it more concrete just in terms of what I envision and how I want to help people throughout my life.
I think we have a moral responsibility to solve these challenges, to be part of the solution.
As human beings, we should not permit other people anywhere, any child that die of diarrhea or malaria or mumps or of many of the diseases that are trivial in this civilization.
Academia engaging in solving real problems and achieving tangible results.
If that saves 1,000 lives or 5,000 lives or 2 children, everybody who is involved in that team is involved in saving that life.
It gives you hope
that it's possible, that something can be done. And I'm hoping to bring that hope back in my health policy major.
I think I will leave with a more inspired opinion of what exactly I can do as an individual and what the limit of that is and what the potential of that is.